Okay, this video is from the book John Mcdougall, The Doctor Who Fought for You. We're on Chapter 10, the chapter about diabetes. Okay, we're going to be going through some of Dr. Mcdougall's lectures and his newsletters. Okay, so Dr. Mcdougall starts out, normal people have good insulin sensitivity. In a healthy person, when insulin binds to the receptor on a cell, like a skeletal muscle cell, it activates the glucose transporters to come up to the plasma membrane, merge with the membrane, and then form a channel so glucose can get into the cell. Those are called glucose type transporters. Okay, in type 1 diabetes, the patient does not have any insulin. Type 1 diabetics do not make insulin because their pancreas has been damaged by autoimmune disease. Most commonly, this is associated with eating dairy foods. So that's important to know. It's dairy that is the best known cause of type 1 diabetes. Okay. Dr. Mcdougall continues, because they don't have any insulin, they can't get glucose into the cells. This elevates their blood glucose, and it's called hyperglycemia. Because they can't get glucose into their cells, they become skinny. So you'll see that. The type 1 diabetics are skinny. For type 1 diabetics, the patient always needs insulin. They always do, or the patient will die. It's better for blood sugar to be too high than to be too low. Too high, you can treat that. Too low, you can pass out, crash your car, faint, who knows what will happen to you. Low blood sugar levels, and you can also be severely hypoglycemic and injure the brain. Low blood sugar levels are dangerous. Aggressive therapy for lower blood sugar, blood glucose levels leads to more patients dying. Yeah, when they try to do those intensive therapies for diabetics, more of them die in the treatment arm. Okay, in type 2 diabetes, the patient has got insulin, even lots of it, but they have insulin insensitivity. They can make twice as much insulin as a healthy non-diabetic person. In type 2 diabetes, the problem is that the insulin receptor is not responding. They've got insulin resistance. Type 2 diabetics are usually fat. With type 2 diabetes, it's always curable with weight loss. You know, Roy Taylor showed in patients of recent onset diabetes less than 4 years, when they lost 30 pounds, every single one of them was cured of diabetes. Okay, Dr. Mcdougall continues. Type 2 diabetes is diagnosed with a finger stick, glucometer, or with blood tests. Normal fasting blood sugar is less than 100, so that's worth knowing. Normal fasting blood sugar, blood glucose, is less than 100. Fasting blood glucose of greater than 126 makes the diagnosis of type 2 diabetes. The threshold of 126 used to be a threshold of 200. They're always lowering these thresholds because then the big drug companies can get more patients to be treated. They sell more drugs. Type 2 diabetes can be diagnosed by a blood test for hemoglobin A1C. Red blood cells live about 120 days, 3 months, then they're removed by the spleen. Hemoglobin A1C is a measure of hemoglobin glycation in red blood cells. So hemoglobin A1C is a measure of glucose control over the past 3 months. If the hemoglobin A1C is over 6.5, that makes a diagnosis of type 2 diabetes. If it's between 5.5 and 6.5, then it's pre-diabetes. The symptoms of type 2 diabetes include increased urine output. You're pissing your glucose into your urine. Unusual thirst, because you're losing all that water. Excessive weight loss. Major complications of diabetes include damage to all tissues, especially the eyes, the kidneys, the nerves, and the heart. Okay, type 1.5 diabetes is under-recognized. This is a patient who will say, my hemoglobin A1C is high, but I'm skinny. Why is that? What should I do? And Dr. Mcdougall would answer, you probably have type 1.5 diabetes, which is a partial insulin insufficiency type of diabetes, because they're thin. And the type 1.5 diabetics also sometimes have what you might call partial pancreas insufficiency. Dr. Mcdougall says, a lot of my patients have type 1.5 diabetes. They make some insulin, but not enough. Type 1.5 diabetics have enough insulin to avoid getting diabetic ketoacidosis, so they can stay out of a hospital, but they don't have enough to metabolize glucose correctly. Type 1.5 diabetics have partial resistance to insulin, so I usually treat them with some insulin so that they don't get too much urine and too much thirst. Okay, it has been known for a long time that insulin resistance is caused by a high-fat diet. In 1927, diabetes expert Elliot Joslin, they have a Joslin Diabetes Center, he wrote that I believe the chief cause of premature atherosclerosis and diabetes, save for advancing age, is an excess of fat. An excess of fat in the body, obesity, and an excess of fat in the diet, and an excess of fat in the blood. With this excess of fat, diabetes begins. And from an excess of fat, diabetics die of atherosclerosis. Yeah, most of them die of coronary heart disease. Okay, also in 1927, J. Shirley Sweeney took a group of healthy medical students and he fed them 2 different meals. Here's the reference, by the way. J. Shirley Sweeney, Archives of Internal Medicine, 1927. When he fed them a high carbohydrate diet with sugar and candy, baked potatoes, syrup, bananas, rice, oatmeal, they all tested normal. So feeding carbohydrates, including the simple sugars, they tested normal, okay, on their oral glucose tolerance test. But when you fed them a high-fat diet, they all tested positive for diabetes. And this reminds me of a quote by Nathan Pritikin. Nathan Pritikin said, "All Americans are diabetic after dinner." Oh, by the way, when you see these brackets, that means it's from me, Pete Rogers, commenting on the stuff that earlier was from Dr. Mcdougall. Okay, this reminds me of the quote by Nathan Pritikin. "All Americans are diabetic after dinner because they eat high-fat dinners. The reason many of them do not test positive for diabetes in the morning is because they've been evaluated after fasting overnight." Okay, so that's it for part 1 of Dr. Mcdougall on diabetes. Hope that was helpful.